Hi, this is Colin Hung from Healthcare IT Today, and I'm joined by Mike Riley, U.S. Vice President of Healthcare and Global Gov Ed Sales at Logicalis. Michael, welcome to the program.
Great to be here.
So let's just dive right in. I have a question for you. That you wrote something recently that was really talking about how getting the right patient information to the right clinician at the right time is obviously very critical in healthcare, regardless of whether we're in a pandemic or not. And you called this just-in-time information. Can you maybe expand on that for us?
Sure. As we were referring to just-in-time information, usually in a care environment, the doctors and the nurses or whoever's really providing care, access to critical information wherever it's coming from is part of that whole making sure that you're providing a quality care experience. Information right now, whether it's on-prem, cloud, application, database work, PACS, EHR information, could be in a variety of different places, different locations, whether it's on-prem or, again, coming from off-site. So being able to get that information fast so they can actually make a good consult is really kind of the meaning around that.
I like that. I like that whole, just in time. It does, of course, invoke some images of just-in-time inventory, right? And that sort of supply chain. And so, what does it take to deliver on that promise of just-in-time information?
Yeah, a lot of it really kind of comes down to the architectures. So we call it foundational IT, right? So if you think about it, if all the pipes and all the equipment and all the different technologies are working correctly and in concert, the information flows pretty fast. Whenever you have gaps or older technology trying to interface with newer technology or things that just aren't architected together, usually you'll see either a delay in the information or maybe a blockage of the information. So the way I look at it is the technology piece is really arterial to the way the information flows. So it's kind of like an artery system. If you have a blockage, then the information doesn't get from point A to point B. So that's really the biggest thing, is making sure you have good foundational IT and it's working correctly.
And is that where Logicalis plays? Is in that sort of foundation IT layer?
We do, yeah. We play in a couple different layers, but foundational IT is a requirement. Like, we'll get into the applications and the workflow and the way the technology is kind of used to take care of the patient. But again, if it can't get from point A to point B, then we have a problem. A lot of times we'll assist with assessments. If they're having trouble with an application or rolling out a new application, we'll take a look at the technology environment, do a gap analysis. Making sure we can identify where the issue may be, and then maybe deploy corrective action for the tech.
One of the things I talk to CIOs about is the fact that getting budget for a lot of infrastructure projects is hard. What best practices have you seen for organizations that have done that well, who do make that investment in that foundational layer so that they can roll out these wonderful new apps and applications that the clinicians really want?
Well, I think that's the key. You said there's making sure the clinical side's involved, right? So from an IT perspective, they're blocking and tackling, they're operational. From a CMIO or really a clinical side, they really kind of need to understand the value of the application, and if they can understand the value of the application, if it's going across an infrastructure that's not architected correctly, then that has an impact to quality of care, and that's what really they're focused on. So I think tying those two conversations together is critical. I think the clinical side needs to understand the value that the IT organization brings to the applications they're using to take care of patients. So I think it's with the organizations that do that well, they seem to get the budget they need to do the things that the population needs for care.
Is there an example that sort of springs to mind of a client of yours that maybe has done this, over and over again? They just seem to be able to get this done?
You know what? A lot of them do. A lot of the clients of Logicalis, I think and one thing that we work on at Logicalis is really kind of explaining the value of IT to the clinical side. I would say majority of our clients actually, they kind of get the budget they need to do, and there's always competing situations inside of a hospital, whether you need you have to buy a CT scanner or you have to do a network upgrade, right? So there's always decisions that are made. But I think most of our clients that go through the process, right, with Logicalis, they really get a true sense of what the value is to some of the IT spend from a clinical perspective.
And just given the breadth of clients that you have, are you seeing any sort of interesting trends in terms of where people are investing right now in terms of their IT infrastructure or any particular kinds of technologies?
Because healthcare is big and complex, it's usually there's really we see a lot in AI right now. We see a lot in deep learning. We see a lot on imaging, 3D pathology. Things that'll, some of these bigger application sets that need a little bit more beefier infrastructure. We see a lot of movement to the cloud. We see a lot of movement to where they're looking at either hosting applications out of a colo or doing SaaS models with different application providers. We see a lot more happening on the outside of the four walls of the hospital or even the data center that they're used to working out of. But we see a lot right now of population health. So if you think of really kind of getting the true value of care is being able to solve what word am I looking for is to provide care outside the four walls of traditional hospital or highly acute. We're seeing a lot of technologies being launched out in the population. So you have mobile, you have security, you have 5G or wireless considerations that you need to be aware of. So there's different things that are happening. I think in the end that, being able to make sure that caregiver gets the information that they need when they need it, regardless of where they're actually located, is really kind of the mission.
One of the things, of course, that we find ourselves in right now is looking at a renaissance for telehealth and telehealth applications, with the pandemic going on and our inability to go to the doctor's office and to go and see our specialists. We're having to use telehealth services, and for the most part, people have been really, really liking that experience. But maybe you can talk to us a little bit about what are some of the sort of underpinning and considerations for actually enabling that, because you just can't spin these things right up. I mean, you have to have some sort of basic infrastructure in order to make these things happen.
You do, yeah, and I'll tell you what, with when the iPhones came out and all the smart devices and all that thing, I mean, a lot of the FaceTime applications, I mean, we've been doing telehealth for a long time. Telehealth's nothing new, right? It's been 20 years. We're doing a lot more video. I think from a quality perspective, right? So the doctors really they need the best quality they can get to provide the proper care and to make sure they're doing the right diagnostics or the right consults for the patients. So you look at bandwidth, you look at access, you look at as these smarter communities are being built with all the different Wi-Fi capabilities out there in the population, I think the tech is just going to get better. If you look at specific departments, like you look at dermatology, you look at ortho, you look at things like that, where they need a little bit more high definition video, a little bit crisper video, so they can actually look at the wound or look at the what's going on with the skin correctly. That just requires more bandwidth, more juice. And then we always have an eye on security. So as these devices are moving around and personal information and things like that are being captured or kept on these devices, I mean, that's something that we have to be aware of as well.
Yeah, you mentioned security. Of course, it should be a priority in healthcare. Protecting personal information, making sure that the data at rest is encrypted, and all those kinds of things. Obviously, that sometimes is not the case, and as we do hear about some breaches and those kinds of things, is there a magic bullet or something you can recommend that starts you on a journey to being more secure as an organization?
I think it's really the baseline, right? I mean, there's all kinds of programs out there, right? There's frameworks, there's specifications, there's playbooks on how to be secure and things like that. But if you don't know where you stand today, if you need an assessment and you don't really understand that gap that you need to plug so you can get to where you want to go from a security position, that's really the challenge, right? Is being able to say, hey, we need to take a measurement of where we are today, and then properly build out and recognize the gaps, and then put an action plan together to plug those gaps, and eventually, you get to where you need to go. But I think the assessment piece, because security and mobility and technology changes so often, I think the assessment, the value of assessment, or the assessment should be done more often, right? Because really assessment is just a point in time. And then if you assess something and it changes tomorrow, then you might not be capturing the right data points you can actually get to where you need to go.
And right now, of course, a lot of IT is being, I won't say rushed, but it's certainly being implemented very rapidly in order to solve the immediate problems that healthcare organizations have in the moment. And I'm sure there's going to be a CIO and a CMIO that's going to sit back a few months from now and kind of go, man, I got spaghetti. I got apps all over the place. I've got infrastructure in multiple locations where I never had infrastructure before. What advice would you give someone in that situation when they're kind of sitting back and going, man, how do I even fix this mess that I created for myself?
Yeah, I mean, I'll tell you what, I think it comes down to actually it's logistics, right? It's maybe able to say, hey, take a look at my entire enterprise. And after we get this through, and after we get through this thing, and we have all this spaghetti on the plate, and we need to figure it out. I mean, you need to slow down, take a little bit, and say, okay, I need an inventory, I need to do a catalog. But actually, what do I have? How is it connected? And then again, making sure it aligns to a strategic plan, because in where we are today, it's with all the grants and all the different things happening with telehealth and everybody trying to set up temporary hospitals, and I mean, people are they're the planning portion of IT today is really kind of, they're worried about servicing the population. They're not worried about planning. Once we slow down, and we're going to slow down, take a look at what we have. Go back to the planning, going back to setting up the strategy, making sure the tech aligns to what we need to accomplish from a health system perspective.
I really like that. I think you're saying. I love that you're saying, hey, take the time, do an inventory, and then make sure whatever that you've implemented actually will help you achieve whatever goal you're trying to achieve, versus just maybe you implemented it to solve a problem in the moment, which is a valid reason. But now when you sit back, you go, hey, that doesn't really line up, and maybe I don't need that anymore.
Yeah, and you look at healthcare. I mean, healthcare is a service industry, right? I mean, healthcare was born to take care of a population, and a lot of times we want to do it right, and you have to follow a strategy. But sometimes in like the situation that we're in right now, a lot of times you just got to go out and take care of people, and then we'll figure out the technology. We'll figure out the way to do it. We'll realign to the strategy. But really, the mission of healthcare is to take care of people.
Mike, what's the one thing you want people to take away from our conversation today? If they're watching this whole interview, what's sort of the one piece of advice or one piece of information you want them to leave with?
I think, that's a great question. I think it's more than one thing, right? Of course. I think with healthcare, healthcare is unique, right? So it's a mission. It's technology is a big part of the way we're taking care of people. I think you need to have a strategic goal. I think you need to make sure that you're aligning your technology, just not your architecture, but also what you're spending, to that strategy. I think you need to have a roadmap. And I think every now and then these things are going to pop up, and it's okay to say, hey, you know what, the strategy's over here, but at the end of the day, the job is to take care of people. And then you go do that. And then you come back, pick up the strategy, and move on.
And Mike, if people wanted to find out more information about Logicalis, where can they go?
Go to our website, so us.logicalis.com, and we have a healthcare microsite, but all of our information's out there. And then, of course, you can find us on LinkedIn, you can find us on Facebook, you can find us on Twitter. But yeah, we're a big organization, and we have a lot of good material out there.
Awesome. Well, Mike, thank you so much for your time today. You showed some really great advice and tips. Really appreciate your time.
Thank you very much. Appreciate being here.
This is Colin Hung at Healthcare IT Today. Thanks for listening.